Hello, thanks for joining me for this hopefully short little video on dental home care that works. So why are we doing dentistry? This is a hidden preventable disease that basically every pet gets. Sadly, studies are showing it's about 85% of pets by age 3. The good news is that we can prevent it, and the pets that get these anesthetic preventative procedures, they're living 20% longer. So the problem is happening in the space between the gum and the tooth, that purple area you see on your left, and that's called the gingival sulcus. And the only thing that gets in there are veterinary anesthetic dental procedures that clean and thoroughly clean that area out. So this is one of multiple videos I have, a lot of times from YouTube. Thank you to the human profession for sharing their videos. They have links down below, so if you want to watch the whole video, or if I skip through parts of it, feel free to go find each link as we go on, read it and find it yourself.
Salivary proteins help form a lubricating layer called the salivary pellicle on all surfaces in the oral cavity. So while this helps in lubrication of mucosal surfaces, it also provides for binding sites that help in adherence of bacteria. Luckily, epithelial cells of the mucosal surfaces are continuously shed, and this prevents an excessive accumulation or buildup of bacterial deposits. The teeth, however, provide for non-shedding surfaces and promote accumulation of bacterial communities if oral hygiene is not well maintained.
So that stuff on the right on the tooth, that biofilm, that is a community, and that is basically can't be penetrated by antibiotics, which we'll talk about in a minute. And biofilms naturally form on all sorts of surfaces. This next video, I would encourage you to use your phone to watch it and look it up, because it's much better than having me use my phone, because it's VR. So as you move your phone, you're moving that.
Once tooth enamel is cleaned, salivary glycoproteins quickly deposit on the tooth surface, allowing pioneer species of fast-growing bacteria in the saliva to bind, recolonize, and quickly begin reforming the biofilm. Then other species attach and continue developing a thicker biofilm. The bacteria multiply, producing polymers, and even communicate with each other, resulting in a complex three-dimensional biofilm. The early colonizers are beneficial, good bacteria. However, they can create an environment for slower growing, pathogenic, bad bacteria to start to thrive. Inadequate oral hygiene allows for a thicker, more mature, and complex pathogenic biofilm to develop, which can lead to an imbalance between the good and bad bacteria in the oral microbiome, a term called dysbiosis. Here, pathogenic bacteria release toxins and enzymes that trigger an inflammatory response in the gingival tissues.
So you can see this is definitely a human video, but that redness along that gum line, that is part of the reason that there is an association repeatedly showing the inflammatory process of the mouth related to other diseases within the body. So they don't actually cause it, but their pets that have healthier mouths are generally healthier. Pets with poor mouths more commonly have other disease processes. And pets with diseases, say diabetes, are more likely to have better diabetes regulation when they have healthier mouths. So cleaning the teeth also helps with pets that already have disease. It doesn't preclude them to dental procedures. So plaque, as we've talked about, it reforms within 8 hours, even after a perfectly great cleaning. But it's normal at that time, and that's fine. It's going to happen. We just need to prevent it from turning into something bad. And we can't just throw antibiotics at it when we think we just want to help something out, because they don't penetrate biofilm, even 1,000 times. And that plaque begins mineralizing into tartar in as little as 48 hours. And that provides more scaffold for things to build up. And that's usually what you're seeing on the teeth, is this tartar that's mineralized and hard and can't be brushed away. So this disease is in the sulcus.
As the plaque mass accumulates supragingivally, it begins to cover the tooth surface and grow beyond the gingival margin. This may lead to the gingival tissues getting inflamed, causing a deepening of the gingival sulcus.
So that gingival sulcus deepens as more disease occurs, and that's deepening usually because of destruction of bone and the tissues in there. And again, that's unseen and hidden. And so this is where the veterinary team needs to work. And this is why any home care that works near the sulcus is better than any home care that works away from the sulcus, as we'll see later. So we can see this patient's painful. They usually aren't that bad. I'm sorry, they usually are this bad, but maybe not so obvious. This patient needs probably every tooth removed. This one on the upper right looks pretty good. Just some mild changes on the crown, but then when we take a radiograph, an x-ray, we look underneath the gum line and see the black stuff around there. That is infection, pain problem, bone loss. That tooth needs to go. And we can't tell what's really happening until we have radiographs or x-rays. So teeth are kind of like icebergs. And in my case, I often do 3D imaging or cone beam computed tomography to look at the teeth of my patients. So Orostrip should be available again. It was available in the past. It's not available now. And it tests for bone loss. So this is one thing we can do. It's a 10-second test that we wipe on the gum line, and then we wait and we check for a color change. And that color change corresponds to a 0, 1, normal, or mild, 2, 3, 4, or 5. That test is testing for bacterial thiols, which are present and related to the bone loss. So if it's a 2, they have about a 50% chance of bone loss. If it's a 3, 4, or 5, they have a 92% chance of bone loss. And this is present in about half of dogs ages 1 to 2 and 87% of dogs ages 3 plus. So this is happening early, at least in this study, and it's more and more common than we think. So we want to try and prevent it before we even get bone loss. And that's why radiographs or x-rays are so essential, and home care after we have a clean slate or started early in a pet's lifespan is helpful. So let's talk about some home care. What's this VOHC thing? This VOHC seal is given by the Veterinary Oral Health Council that shows that a study or product has research to verify it works. It only has to show a 20% reduction over non-treated, so not much at all. And there's a whole bunch of products out there that are marketing. They're not showing that it actually works. So use products that have a VOHC seal so we know that they work. And so we'll review a bunch of those now today. VOHC gives plaque and tartar seals, one or both. And we can divide all of our home care choices into active methods or passive methods. Your typical active methods are brushing and wipes. Your passive choices are food, chews, rinses, or additives. So food, if we start with the simple ones, we always have to feed them anyway, so why not feed something that will help? So this Royal Canin food as an example, has a VOHC seal. It has a different kibble shape, a different kibble structure that allows it to stay intact longer as the pet chews, and it has a tartar control effect. Oral health foods at the store are not the same. A lot of products out there, when they use a tartar control, use sodium tripolyphosphate, which is what's in human tartar control toothpaste. And depending on which study and which product, they're shown to decrease calculus by 20 to 80%. It wasn't very much change, or basically almost no change in this product. So when they added the plaque-reducing nutrient, which is a vitamin C relative, that's what this product has in it. It decreased the plaque by 5%, further than just the kibble shape and surface area and structure change. So a total of 27% reduction with this food. Chews, we want to use something again that has a VOHC seal. And so these are 3 examples, not just something that has a mechanical crown action, which may not even work at all. So we have to make sure we don't just use stuff at the store. Here's an example. This is a VOHC sealed veggie dent chew. It has a 37% plaque reduction. And sometimes with the other benefits, they may be more because they've changed some of the formulations for the other benefits. Tartar Shield treats have a 40% plaque reduction, and some of their rawhide ones, their rawhide has been broken up and then kind of put back together so it doesn't cause any kinds of obstruction situations. Their cat ones, by the way, are about 1 calorie a piece. They're really low cal too. Oravet chews, I like them because they're soft and chewy and they're squeegee the teeth, and so they can be helpful, and they really do help with halitosis. And they have delmopanol, which continues to try and be a barrier, reducing plaque attachment. The problem is that some pets have green feces, which can be disconcerting to owners, and the price point is something that is disconcerting to owners. And so a lot of veggie dents are the ideal chew in my practice. Otherwise, we want to make sure if you're using a chew and that you use something that passes the chew test. Are they bendable? Are they compressible? Basically, it's a thumbnail test. If you can indent your thumbnail into it and it compresses or makes an indentation, we're good. But if your thumbnail bends or breaks, then it's going to have a high chance of breaking the tooth. And when I go buy this bones at the store, I say, oh, I really want to do like at the Antlers and just put my business card out there and say, thank you for supporting our dental practice. But that would not be allowed. So I don't. I just think that the leading cause of tooth fracture in my office are knuckle bones and antlers. And here's an example. This one I'm not sure if this is from the same thing or not. This dog recently broke its lower canine and its upper, but it wasn't full through and through on the upper. Also had a broken tooth from chewing on something on the left side and had plaque and tartar covering it. And we thought it was kind of like this other upper where it wasn't all the way through. Cleaned it off and cleaned it all off and realized it was through and through. And so we turned these into root canal therapies, and to restore the full structure, we then put crowns on them. And the one on the upper could be restored without root canal. The crowns then return the tooth to the normal strength that it was before, as opposed to the weakened state that the fracture created that can't return it fully to normal with the root canal therapy. So what's inappropriate? Bones are inappropriate. Antlers are inappropriate. Nylobones are inappropriate. Tennis balls are in this gray category. They pass the thumbnail test, but they have that fuzz, and that fuzz is abrasive. And the dog chews and chews on them and wears their teeth away and still creates open pulp chambers in some cases. Other times it does fill it in and it's okay, but it can create sharp points and plaque retentive surfaces. In 2010, the FDA put out a warning about bones being unsafe for your dog and how they can cause breakage. You also want to think about when you give other treats that they can get things caught in there. This is a tooth that the dog chewed on things and wore things away, and at some point caused enough of a concussive injury that it caused the tooth to die internally, and then it kind of leaked out and has disease at the tip of that root. And so the choices for this tooth were root canal therapy or extraction. And we went with extraction because that one was not a structurally significant tooth like the other two we saw before. This dog likes to chew, like a lot of large breed dogs, on lots of things. And when they're constantly chewing, that almost jackhammer action, the body tries to stabilize it, and it kind of takes away the periodontal ligament and attaches it to the jawbone, and it kind of moth-eatens it away. And when it breaks, it's very hard to extract, leaving you pretty much the only choice of root canal therapy in some cases, or really involve pain in the patootie oral surgery to extract the tooth that has this still vital nerve and blood vessel supply that creates infection and pain we need to resolve. So back to after chews, we have rinses. And there's a lot of different rinses out there. We're looking for something that has a VOHC seal. And the only one that I'm aware of is the Healthy Mouth line. They have a whole bunch of different types of rinses and other types of toothpaste and things like that. Their Healthy Mouth rinse had about a 77% plaque reduction, and it has a zinc benefit in it. Some people use it as a rinse, others use it as on a wipe, as a wipe, or as a water additive, just as drinking water because they come in different flavors. I like it after an extraction for the healing phase, but otherwise it's not my favorite choice. But we can continue and use those zinc benefits with things like MaxiGuard wipes that are a wipe and it goes along the gum line. And so it makes it easy to teach the pet and then accept brushing. And it's not messy, and a lot of times they taste really good for the pets. So this is how I like to teach to brush, and it's just using a wipe.
Really like using the wipes.
So you start from the rim, work
No,
forward.
I kind of pull back.
Oh, back. Okay.
Yeah. And then you just keep scratching him and scratching his ears, and then you give him a little more cheese.
Got it.
There you go. There's your cheese. There's your cheese.
Well, thanks to Dr. Lowprice. That was a great video. I love following with a treat, but I usually follow with a Pet Smile toothpaste. And Pet Smile toothpaste is a beefy flavored toothpaste with a 62% plaque reduction. Other toothpastes are made by Healthy Mouth. CET makes a good toothpaste. And so there are a lot of different choices out there. Pet Smile is the only one. Well, I'm take that back. Healthy Mouth and Pet Smile have the Healthy Mouth, the VOHC seal. So, but I really think the flavor of the Pet Smile is great, and it can easily be used as a treat action following that wiping brushing effect. So you can brush with the Pet Smile, you can use the wipe and then follow with the Pet Smile as a treat. And that video I showed, that was about 10 seconds long. So 10 seconds on each side, about 20 seconds a day is all it really takes to have pretty darn good home care, which is helpful. With the toothpaste, we can use a taste test, lots of different flavors out there. See which one the pet likes. Make this fun. So brushing daily was shown to be twice as effective as every other day. Well, that makes sense. But brushing less than every other day was equal to not brushing at all. So if they brush weekly or 4 times a week, less than every 4 days, things like that, it was equal to not brushing at all. That means if you go to the groomer and pay them to brush your teeth, you may as well throw your money in the garbage to do about the same effectiveness over that time period. So brushing is your gold standard. It has the closest action to the sulcus, and if you just brush without anything on it, it still gets you 40% less plaque reduction. So it is hugely helpful. Sadly, of those that brush, about half still remember to do after 6 months. So when we make it more of a treat action, it becomes more fun for the pet as well. And then the pet might remind you to brush the teeth. For those that know and admit that they can't brush, then maybe consider Sanos. Sanos has a 24% calculus reduction and a 40% plaque reduction, which is very much similar to brushing. After a clean slate, like after a dental procedure or when they don't have any problems like with a spay or neuter and you have adult teeth, you can apply that, and it acts kind of like a bandage in that sulcus and sealing it against plaque, kind of basically preventing it as a glassy surface before the biofilm redevelops. If they use other home care, it can kind of wear it away faster. But if you know you're not going to use brushing, consider Sanos. So where do these products work? I'm going to skip through this video. If you want to use the link below and look at it, it kind of shows that everything happens on the gingival third.
Microorganisms.
And so your diet and chews mainly work at the coronal 2/3 of the teeth. And our brushing and Sanos work near the sulcus. And our rinses help the gum line and can affect biofilm. And so we have to remember that teeth that are malaligned, they have breaks in the tooth, they have existing calculus, these are plaque retentive surface, and that causes more disease to accumulate. And so let's choose something. If we don't know which one to pick, then let's use one that can work best at the gum line, which would be brushing, more of your active home care. Now, all these numbers are probably too many numbers. And so we have to remember that these are reductions over baseline. So we're helping no matter what we pick, but let's make sure that we continue to bring that baseline back to 0, because the baseline in disease still rises even if you brush all the time. It doesn't replace the need for anesthetic dental procedures, but definitely extends the time between them. In the Buckley study, pets with home care, about when they came back for another procedure, only 15% had a problem on the next procedure, but about 40% have it when they don't do home care. And 44 is pretty close to 50, so half in a dog. So interestingly, they did a study of dogs that they didn't want to do any home care. These were 35 20-pound dogs, and all of these 35 dogs that were aged 1 to 7 changed from gingivitis, so they started with a clean slate with the dental cleaning, and they monitored them, checked on them every 6 weeks, and it changed to bone loss, some periodontitis of some sort, in 60 weeks. So every single one of them had some bone loss in 60 weeks. And they noticed of these 35 that for every year older they were, this happens 5.5 weeks sooner. So this study didn't have any dogs that are older than 7. And so we know dental disease happens when they're older. So this is happening sooner. So which one do we pick? Pick what works best for you. But when we compare, if you're using a VOHC sealed diet, brushing works almost 4 times better than diet. So you can use both. Or if you have to pick one and you think you can do brushing, choose brushing because it works better. If you want to use chews because it's a treat, well then do it. Have fun with it. Just realize that brushing works 3 times better. So use what's doable or multiple choices in cases. Our goal is to prevent dental disease before it happens. The red gums you see, those are painful. Dental procedures sadly aren't a one and done thing. Periodontal disease comes back. Just a question of when, and that's based on individual responses as well as the ability to treat with home care. Pets require anesthetic dental procedures every 6 to 12 months. In general, it's every year, but sometimes they have changes that said there's already bone loss. The only way home care alone isn't sufficient. You have to come back sooner to get that cleaner slate again before you can actually go out to a year. Now, I'm going to interject here. That study, the Marshall study that showed that they all had bone loss within 60 weeks. And this is I'm extrapolating here, this isn't direct. But if you take the 62% effectiveness of the pet smell toothpaste and plaque and multiply that out, I think that's like 100 weeks. So essentially, if you have home care on board, the most you're going to be able to last is every 2 years if you have the perfect pet that doesn't respond with severe individual responses. So basically every year is what a pet needs, sometimes more frequent, and the least you can pretty much go without having some sort of bone loss is probably every 2 years. So every owner should choose what works in their household and do it daily or every other day. If you have questions, send me an email. I can be found on Ignite Vet if you'd like to go there. Thanks for listening.